Any doctors on board, please come to the front of the plane. I'm like, y'all, I just had my first in-flight medical emergency on a plane. That is right. This is a day that I have been fearing for pretty much all my years of being a family doctor. Not because I don't want to help someone who's having an in-flight emergency, because I've been afraid that I wouldn't know what to do or may not be able to help them. And today was the day. I was on a flight. I was taking a nap in my seat, enjoying. When I woke up, I enjoy a little soda, this and that. We were getting ready to start, getting to our destination. All of a sudden, I hear on the overhead monitor, we have a medical emergency up in first class. Are there any doctors on board? Are there any doctors on board? Any doctors on board? Please come to the front of the plane. I'm like, oh my gosh. Again, not because I don't want to help, but because I was just afraid I wouldn't know what to do. I'm a family doctor. I haven't done medical emergencies like acute care in years. I don't work in an emergency room setting or a hospital setting or an ICU setting. I haven't been involved in a code in years, etc. But I have often worried that I would be called on a plane for a medical emergency. So I've often thought, okay, what would you do in case of emergency? Check blood sugar, check blood pressure. I don't know. This is just my way of sort of hopefully preparing. And doctors, other medical health professionals, what do you do? Anyway, they called for a doctor on the plane, and I'm like, and I literally look around behind me because I was sort of in the front section of the plane. No one's getting up. I'm like, oh my God. I'm like, Jen, you have to get up. So I start getting up, and luckily I turn around and I see someone else getting out of their chair, and I'm like, thank God, at least I'm not the only one. And I was so grateful for that. I start making my way up to the front, and what I'll say is that this person was having some head pain. They were hysterical, they were crying, they were very upset, and seemed to be in distress in terms of pain. No shortness of breath, no chest pains, they weren't, blacking out or passed out, anything like that. On examination, the patient didn't have any sort of signs of bleeding or trauma, which was excellent. Of course, I couldn't really fully look in their nose or mouth or things like that, and their ears and stuff like that. But on sort of gross examination, they were doing okay. And I think it was probably a combination of, head pain / sinus pain / stress, fear, and some other components going along. What I will say is shout out to the other doctors who got up and helped. There was an oncologist, an EMT, a psychiatrist, and other people who got up and helped, and that was so awesome. I ended up talking to the family of this individual, and what was really great, because I've never been involved in a medical emergency, we landed, I think we were probably able to land sooner than we might have in terms of getting to a gate. And as soon as we got to the gate, the captain asked everyone to stay in their seat, and they brought on medical personnel to evaluate the person who was having the issue. So they came onto the plane, everybody was still seated, evaluated the person, and that person was able to walk off successfully and hopefully continue recovering, which is excellent. Still don't know exactly the final diagnosis, but what I know is that they were stable, and thank God for that. I'm grateful that that person is okay. I wanted to share with you this experience because literally for years I have been wondering what it was going to be like when I get called for a medical emergency, because I knew it was coming, but I'm grateful that that person is okay. And for all those docs and healthcare providers out there who are first responders and work in emergency care, God bless you. Woo.